So what we're going to be discussing tonight is what is the GAPS syndrome, and that's what GAPS stands for, is this GAPS syndrome. What is the role our digestive system plays in our overall health? What is the connection between the gut and the brain? What the GAPS nutritional protocol approach to aid the healing of digestive system is all about, and what you can do to reduce toxic exposures and nourish the body. So as Sandy said, GAPS stands for Gut and Psychology Syndrome. It also can stand for Gut and Physiology Syndrome, and Dr. Natasha is actually in process of writing a book that is going to be talking specifically about gut and physiology syndrome. And physiology would have more to do with the body as opposed to the psychology syndrome, which has to do with the gut-brain connection. So Dr. Natasha Campbell-McBride is a fascinating woman. She was born in Russia. She became a neurologist. She went on to become a neurosurgeon and moved to England and had a baby. And at the age of 3, her son was diagnosed with autism. As a medical professional, she knew how crushing that was, because at that point, nobody had any solutions. And here she saw her son, who couldn't speak, who wouldn't look at them, who ate only very restricted diet, who had all these self-stimulating behaviors. And she said, I have to do something. And so they started on this ABA, you probably all, I see some nods here, that it's a program for trying to help with the behavioral aspects of autism. And then she went back to school and actually got her postdoctorate degree in nutrition because she firmly believed that there had to be some kind of a nutritional component to it, because she said, my son ate virtually nothing. Junk food was really what he wanted to eat. And so she firmly believed that there was a connection. And she ended up finding the SCD diet, which stands for the specific carbohydrate diet, and that is what GAPS is based on. And then as she started treating him, she discovered different things that worked and things that didn't work about the SCD diet, and so she has modified that to become the GAPS protocol. She discovered that her son's gut issues improved dramatically as she started to treat him with this diet. And so not only did the autistic symptoms drop, but all of his GI problems that he had had. He had a lot of constipation, a lot of diarrhea, alternating back and forth. And so she discovered that he didn't have all of the foul-smelling stools, all of the gassiness, the abdominal pain that seemed to come from having a buildup of gas in his belly. So this presentation is an introduction to the work of Dr. Natasha Campbell-McBride and her GAPS nutritional approach. The perspectives presented are based on the book, Gut and Psychology Syndrome, the revised edition, and Oriana's is selling them in the back. Of course, I highly recommend the book. I think it's fascinating. And actually, I read it I read her first book, which was in 2004. And I thought it would probably work. We have a son with Crohn's disease. He has since developed celiac disease. He has multiple food allergies, fights depression. He has a lot of symptoms that let us know that he is a GAPS child. And he was a child that had a lot of ear infections as a baby and was on antibiotics as a baby, which I believe is what has started this entire cascade of events that has happened in his life. So I read the book and I thought, I could never do that diet. There's just no way. Then she put out the second book and revised it, and so I had to get that, of course, because I was fascinated by the first one. And as I read it, I thought again, this would work. I know it will work. And so last summer, there was an opportunity to become a GAPS practitioner. You had to be a health professional, meaning you had to have had your anatomy, physiology, pathophysiology, microbiology, and all of those things, which I had because I am also a nurse. I am a registered nurse and have been since 1981. And so I had to apply. Dr. Natasha went through all of the applications, and I was lucky enough to be one of the people, one of the 160 people who was in the first certification class There were 4 classes held around the country. One was in Oregon, one in Chicago, which was the one that I went to, the one in New York, and then one in Texas. And I was fortunate to be able to become certified in this. And as I have discovered, it has become the passion of my life. So I'm presenting these things not from the perspective of a nurse, so much as I am presenting it from being a certified GAPS practitioner. So what do we know? We know that genetic disorders do not show such a dramatic increase in incidence as autism has demonstrated in the past 20 years. The current CDC numbers that came out in April say that 1 in 88 children in America have autism. This is a shameful epidemic. In 2004, it was 1 in 166. What is causing this? 20 years ago, 25 years ago, autism was a very rare disease. How is it we can have this explosion of children with autism and not be doing something to find out why and trying to fix the problem? Now, how many of you know somebody who has autism?
I have it.
Okay. Okay. Would you all agree with that statement that you cannot believe that there is such an epidemic of it and that we're being so laissez-faire about what we're doing about it? I find that shocking. So the increase cannot be explained by better diagnosis, because I've heard that. Oh, it's just that we just didn't know how to diagnose it before. And they changed how they're diagnosing it. They're changing what the criteria is for diagnosis. That's really what the problem is. And if that were the case, then we would be seeing far more people walking around who are in their 20s, 30s, 40s, 50s, and 60s who were displaying signs of autism. And I'm sorry, I'm not seeing it. So this is Dr. Natasha speaking as well. This is where, I mean, when she said that in our certification, at the very beginning of the certification, it was like, well, yeah, that makes perfect sense. Of course we're not seeing all of these people as adults. There truly is an epidemic of autism. So Dr. Natasha believes that the underlying problem in autism starts in the gut. Children with GAP syndrome often fall into the gap of our medical knowledge. And that was part of why she used the moniker GAPS, because she truly felt that there was a true gap in our medical knowledge and that these children fell into that. Another group of conditions that fit into the GAP syndrome are schizophrenia, depression, eating disorders, bipolar disorder, and obsessive-compulsive disorder. Many other chronic and autoimmune diseases are associated with gut imbalance. One of the handouts in the back has a list of the conditions that are considered GAPS conditions. This one lists 76 conditions. And I pulled this off Dr. Natasha's website. So if you happen to pick that one up, it's on the one that says Top 10 Influences on the front, and on the back are the 76. And when you read all of those, can you name a family in America that doesn't have multiple of these conditions? So a word about vaccines. When you're talking about autism, it is impossible to avoid the issue of the MMR vaccine and vaccination in general. That's a direct quote from Dr. Natasha. From her own personal experience and from her medical judgment, she says it is the state of the child's immune system that appears to be the decisive factor. And then in her book, on pages 67 to 71, she makes recommendations that a thorough evaluation be made to determine an infant's immune status, which will lead to a decision whether to give the usual vaccine dose, none at all, to delay vaccination, or to vaccinate with single agents. She has the conclusion that while the MMR and other vaccines may not be the cause of autism, in immune-compromised children, they can do a lot of harm. And in some children may well provide the trigger that starts the disorder. And later on in the presentation, I will have a website up there for you, but that comes directly off gapsdiet.com, which is one of Dr. Natasha's websites. And it's a direct quote from her again. GAPS children, it's not just about autism. It's about autism, it's about ADHD, ADD, it's about dyspraxia, which is extreme clumsiness. It's about dyslexia, behavioral and learning problems, allergies, asthma, eczema, digestive abnormalities, autoimmune conditions, neurological problems like seizures. Now, there are a lot of children out there who don't have autism, who have a lot of these other symptoms. They're also GAPS children. All of these conditions share a common theme. The immune system is damaged and it needs to be healed. So gut flora, otherwise known as microbes, that can be bacteria, yeast, fungus, viruses, parasites. They can be a variety of different things. They are essential to our health. About 90% of all of the cells and the genetic material in our bodies are gut microbes. 90%. I think that's an amazing number. I can't believe it when I read that. But when you think about how tiny those organisms are, how essential those are to our health, it's incredible. We have about 10 microbes to every human cell in our bodies. So we actually are more microbial than we are human. For a healthy immune system, an infant needs to have a balanced gut flora established about in the first 20 days of life. Otherwise, they will have a compromised immune system for the rest of their life. So types of microbes in the gut. You have three basic kinds. You have beneficial flora. Those are the most important. They're the most numerous in healthy people. They're the friendly guys. They're the ones you need to have. They're the ones you want to have. And then there's the opportunistic flora. They know of at least 400 different species. They're normally limited, tightly controlled by the beneficial flora, but they cause disease when they're not controlled. And if you think about it, I don't know how many of you know of somebody who has been on antibiotic therapy, and they ended up getting C. difficile, and it's the diarrhea that you can get, and Clostridium is a very, very difficult organism to eradicate. It is an organism that does not like oxygen, and it likes to burrow into the gut, and it has a wonderful home there, and as long as we feed it things that it likes, it doesn't want to leave our bodies. The other thing is yeast. Yeast is another thing that should be kept in balance. All of these organisms are in our bodies normally, but they need to be in a right balance. And so if you have 20% of those opportunistic and 80% of the beneficial, you probably have robust health. If you reverse those numbers and have 80% of the bad guys and 20% of the good guys, you are probably a very, very sick person. And then there's the transitional flora that are taken in with our food and drink. It's possible that they can cause disease, but they usually will pass through without harm because the beneficial microbes are protecting us. So the picture is supposed to be Space Invaders, in case you're wondering. I thought we're doing something about children. I should put something in there that's Space Invader-ish. So the role of the beneficial essential gut flora is that it protects our bodies from invaders. It helps to create and maintain the integrity of the gut lining. It helps with the digestion of proteins. It helps to ferment carbohydrates, and it helps to break down fats and fiber. It helps with absorption of nutrients through the gut wall, like minerals, vitamins, water, and other nutrients. It helps to produce vitamins There are a whole boatload of B vitamins. You probably have heard of like B1, B2, B3, B4, B5, B whatever, B12, B12 anemia. A lot of those B vitamins are produced by our gut flora. So if you know of somebody who has B12 anemia, I would dare bet that there's a connection, that they don't have the right kind of gut flora that they need. Otherwise, they would be producing that. They also help to detoxify. It has been shown that if you have good gut flora, that as you take in things that are toxic, things like mercury, things like that, that the gut flora will actually capture it and help to eliminate it from your body. It also helps to modulate and adjust the immune system. So the theory of the leaky gut. The leaky gut comes from the concept that the beneficial gut flora are not adequate to protect the gut wall. That allows the disease-causing microbes and toxins to attack it. That causes damage to occur to the cells where digestion and absorption normally occur. The tight junctions in the wall open up, and that's what that picture is supposed to indicate, is that the pink things that are sticking up, if they're too far apart or if they don't have a tight junction there, it lets those other microbes get in there and pass through the gut wall. That allows partially digested foods to be absorbed. The damaged gut lets the toxins and the microbes into the bloodstream, and we end up getting food allergies, food intolerances, and it causes us to have autoimmune conditions. So then there's the gut-brain connection, that river of toxicity. GAPS children often do not have the essential stomach acids needed to digest proteins. Dr. Natasha feels this is usually because of a yeast infection. Substances that are similar in chemical structure to morphine and heroin from the improper digestion of proteins like gluten in grains and casein in milk leak through the gut. And you've probably heard of the gluten-free, casein-free diet, and that's trying to attack this issue because they found that the morphine and the heroin type substances are running rampant in the body of these children, and by eliminating those, that you can often see quite an improvement in their behaviors. The out-of-control opportunistic microbes contribute toxins, which then causes a river of toxicity that bathes the entire body, including the brain. So why do you suppose this happens? Dr. Natasha calls them the GAP family. When the infant comes through the birth canal, he or she picks up the mother's microbes. And this is where the infant's immune system gets its first lesson. If the mother has an imbalanced gut flora, this gets passed on to the infant. So you say, okay, well, what happens? If I have a C-section, that's not going to happen, even if I have an imbalanced gut flora. Well, that's not the case, because when they come out from a C-section, they don't have any microbes to speak of. And so now whatever they get exposed to in the environment is what is going to determine what their immune system is like. And the mother's flora is, of course, influenced by the father's. They regularly share their flora back and forth, which is how she ended up getting pregnant, right? It's also, the birth control pill can contribute to problems. Antibiotic therapy can also contribute. A diet that is high in sugars, in processed foods, in starches, stress, all of these things and more can contribute to that. So mothers of GAPS children have a lot of commonalities. They often have digestive disorders, diarrhea, constipation, bloating, cramping. They often have asthma, eczema, hay fever, and other allergies, migraines, PMS, arthritis, skin problems, chronic cystitis, and vaginal yeast infections. Now, they may not have all of those symptoms, but you'll see quite a large number of those symptoms in mothers of GAPS children. So how can we damage those beneficial flora? There's a whole lot of ways to do it. Antibiotics are probably one of the biggest in our society. Since we started using antibiotics, there's been a huge increase in these kinds of problems. And what happens is, and we know that antibiotics are to go in there to kill a pathogen, a bad bacteria. And so we take it for that reason. But in the process, we also know that it kills a whole lot of other organisms as well. They call those broad spectrum antibiotics. So they get rid of whatever is causing the problem, and then they take along a lot of good guys with them. And if you don't replenish those good guys and get them back in balance, and that can take you many months, even after just one episode of taking antibiotics, you can have this going on for 2 or 3 months before you can get your gut balance back, and it will likely not even ever be the same again. But then there's also steroids. How many people do you know are on prednisone or have been on prednisone? The birth control pill, other drugs, again, the poor diet, infections, disease, stress, bottle feeding. And I was amazed when I was preparing for this, how many children nowadays are being bottle fed instead of breastfed. It was astonishing. It was like 40%, 44%, something like that. And when you have breast milk, there are naturally good flora that get passed through the breast milk. So for a child that doesn't have the breast milk, it sets up their whole GI system with a different bacterial flora. Unfortunately, old age, as I'm learning as I get older, is contributing to an imbalance. Pollution, radiation, alcohol, toxic chemicals, dental work, mercury amalgams, which as I was growing up, I got a whole lot of those because I liked my soda pop and I liked my sugar. And unfortunately, they're still in my body. And I'm sure that mercury is still degassing to some extent and is causing some issues within my body. And this is not a full list. This is just the things that came off the top of the head. So it's very, very easy for our gut flora to become imbalanced. Now that being said, there should be no guilt allowed. We are what we are. We're part genetic inheritance. We're part microbial flora that we got from our parents. We're part because of our eating habits. Part of it is our health issues and the treatments that have been used to try to heal our health issues. And it's part lifestyle and choices. What is important is what we choose to do about it now. So now we understand some of the contributing factors to the symptoms that we see. What can we do about it? The good news is that there is hope. Dr. Natasha has had incredible success with the GAPS nutritional protocol. She has a nutritional practice at the Cambridge Nutritional Clinic, I believe she calls it, in England. And she has been doing this now for nearly 14 years and has treated, as of 2003, she had treated over 400 people in her clinic. And so we're now 8 years later. So I'm sure that she has come into the thousands of people that she has treated directly in her clinic and that have been also been impacted by the books that she has written. The younger the child is when interventions begin, the less damage there is to undo and the less catching up they need to do in their development. It kind of makes sense. If you have permanent damage to something, it's harder to repair it. However, I have a friend who has an autistic son, and he is in his 20s. And she started on the protocol in October, about the same time my husband and I did. And she said that there was a dramatic improvement in his symptoms within the first month. Once they got past the die-off phase, she's seen a tremendous improvement in his behaviors. So depending on your commitment to the treatment plan and the circumstances involved, dramatic improvement can occur. Getting the diagnosis early gives parents a chance to intervene early and gives the child a better chance of total recovery. The good news is for Dr. Natasha is that her son was diagnosed at 3. He started on the ABA therapy when he was 3.5. By the time he was 9, he was in a regular school. And by the time he was 13, you could not tell he had symptoms of autism. So although it takes a long time, he was diagnosed at 3, and it took him 8 years, 9 years. So it took 3 times as long to try to heal him as it took for him to develop this condition where it was diagnosable. So there's another handout about what the goals are of the GAPS nutritional protocol. So the major thing we're trying to do is normalize the gut flora. We're trying to heal and seal the gut lining. We want to restore normal gut function. We want to correct nutritional deficiencies, because you can well imagine that if the gut is damaged, that it is not digesting the food correctly and it's not absorbing the food correctly. And if that's not happening, then there's going to be nutrient deficiencies in all kinds of things, macronutrients, micronutrients, vitamins and minerals especially, a lot of the enzymes that you need to have to process your foods. GAPS is trying to restore immunity, remove the river of toxicity from the body, and restore the body's detox system. So the key treatments according to GAPS. First is the diet protocol. The gluten-free, casein-free is not enough. It's a good step in the right direction, but it takes more. Supplementation, and we're not talking a bag full of supplements. I don't sell supplements. I recommend to you the type of supplement that you need based on what the Dr. Natasha's protocol says based on the symptoms and the history that I received from a client. But it's not that you need to be taking boatloads of supplementation necessarily. So. And then there's the detoxification and the lifestyle changes. So the principles of the GAPS diet, that's also on the back of this handout, is to reduce toxic exposure. The primary way to do that is to get rid of processed foods and drinks. Think Pepsi Cola, Coca-Cola, any kind of bagged chips that if you read the label on them, you can't pronounce, at least I can't pronounce about 3/4 of the things that are on that bag. And then to remove environmental toxins. And then the other thing is to optimize nutrition. And it's done in 4 basic ways: broths and soups, natural fats, fermented foods, and organic meats, eggs, vegetables, and fruits. So the stages of the diet. There's the introduction, and it's basically 6 stages within the introduction diet, and it basically is an elimination diet. If you start from stage 1, you start very, very basic foods, and then you slowly increase the types of foods that you have, and make sure you're not having a reaction to it before you add the next food. And then there's the full GAPS diet, and for some people who cannot handle the initial shock of going to the introduction diet, there are times that we start on the full GAPS diet and then take them backwards, or stay on the full GAPS diet for a while, get used to how the cooking is done, and then you can go back and do the introduction diet. Or if you start having things like diarrhea, abdominal cramping and those kinds of things, you may choose to go from full GAPS and then go to stage 1. And then there's transitioning off the GAPS diet. The GAPS diet is intended to be for healing. It's not a short-term fix. It's something that is done over a period of time. And so you really need to be free of symptoms for a year. Typically speaking, most people need to be on the diet for about 2 years just to get to the level of healing that it takes. It takes a long time for us to get sick. It takes a really long time for us to heal. So to determine whether to start with the intro diet or to go to the full GAPS diet, A full evaluation should occur to identify the symptoms, the current diet, and the challenges anticipated when implementing the change. One of the things that people need to realize is that this is not a diet that you can do and go out to McDonald's on a weekly basis, or actually ever. McDonald's is not one of my favorite places to talk about because I don't know of anything that they serve that has not been adulterated in some way with some kind of chemical, words that you can't even pronounce. So the point of this is that we're nourishing the body and we're taking away the things that are toxifying the body. So what can you eat? There's a lot of things that you can eat. It's like eating gourmet, I think, because you're getting the very finest products that you can afford, and you're preparing them yourself so you know exactly what's in them. So you have wild-caught sustainable fish, organic meats, pastured eggs, non-starchy vegetables, fermented foods. You notice that fermented foods are going to keep cropping up throughout this entire presentation, so just kind of pay attention. Broths, soups, and stocks, and natural fats. And the natural fats is an important piece of it as far as Dr. Natasha is concerned. She really, the major thing is get rid of the processed foods, number one. And then there's like a three-pronged approach with the broths, stocks, and soups being the first, the fermented foods being the second, and the natural fats being the third. If you have time just to play on the internet sometime, you should go on and go to Wikipedia and find out how they make corn oil, canola oil, vegetable oil. Did you know that none of those oils existed before 1898, I think it was? And that they process them using high heat. They also use things like hexane, which comes out of our oil industry as a waste product. I was doing that for another presentation I'm going to be giving in October, and I was pretty shocked when I saw what kind of things we do. They actually have to deodorize it when they're done with it, all of these oils, because they smell so bad when they finish it that nobody could stand to eat them if they didn't deodorize them. So, even organic versions, I think. There may be some that have been cold pressed or whatever, but generally speaking, most of the oils that you see in any of your typical grocery stores are going to have been processed that way. So the organic ones have a different mechanism, I'm sure. Right? Yeah, Sandy's saying yes. So what is allowed in moderation is all ripe fruits, including dried fruits, and to start slowly with those. And the reason is that fruit naturally has a lot of fruit sugar. I call it fructose, some people call it fructose. And any kind of sugar will feed bad bacteria or bad microbes. And so initially, if you're trying to get to the point of getting the bad bacteria into control, you want to try to minimize that as much as possible. Now, when you're working with autistic children, that may be difficult because typically speaking, the foods that taste really good to them are the ones that are very sweet. And so if you're going to make choices like that, if you can get them over to like the organic dates that we have back there and the raisins and those kinds of things, even though they're a fairly concentrated sugar, then we would start to make that transition first. Honey or stevia are the only sugars that we use. Stevia is a natural leaf that is processed to some extent. And then honey. Now you can't use that on infants less than a year old unless you put it through a pressure cooker for a certain length of time and take care of the part of it that they can't process when they're an infant. But otherwise, honey is, in fact, that's what I bake with now. I don't bake with anything else except honey. Nuts and seeds, but they need to be properly prepared. Nuts, seeds, grains, all have something in common, and they have a substance called phytate. And what phytate does is it blocks the absorption of minerals. So if you have an autistic child, they're already not absorbing things well. So now, if they're eating a lot of nuts that have not been soaked for 8 to 10 to 12 hours to get rid of the phytates, they're going to be blocking the minerals that they are ingesting. Now, they're probably not taking that much in. That's really, really great for them anyway. And now you're blocking, even the good things that they're getting. And so you definitely want to limit that. And we try to suggest that the nuts, I think it's those nut butters, are started at stage 4 out of the intro diet. And so it takes you actually several months to get to that point. Again, we have to adapt it sometimes depending on the individual needs of the child. And then we're out to starve out the bad guys. So to do that, we avoid all processed foods. If it comes in a box or a bag, and if it looks like something that would be advertised on television, it's probably not anything that should be consumed by an autistic child. All additives, sugar and commercial sweeteners. This diet takes out all grains. That includes gluten-free grains. All starchy vegetables, milk sugar, because lactose is a double sugar, and only fermented dairy is allowed, and that usually doesn't happen until later on in the diet after a certain amount of healing has occurred in the gut. And then beans. Non-starchy ones are allowed later in the diet. And beans does not mean the green beans that we're enjoying so much from the farmer's market right now. We're talking about the dried beans. So why do you suppose we don't want to have those things in our diet? It's because starches are actually a whole lot of sugars that are bonded together. So the problem is that the damaged gut is not able to break down those starches. So the starches sit in the lumen of the gut, and they feed those bad microbes. And they have a field day with those starchy foods. And so they proliferate, they grow, they multiply, and they basically are taking over our children's bodies. So then we replace them with the good guys very, very carefully. Often when somebody starts on this diet, especially a child who has had a very high carb type of diet, they have such an imbalance in the gut that simply removing those processed foods from them is enough to put them into a condition we call die-off. And that's where the bad microbes are dying and they're releasing their toxins. And so there's actually an increase in symptoms initially, and we try to control that die-off so that it's not so problematic that you can't handle the child's behavior. So the first thing to do is, of course, get rid of those processed foods, and there's probably going to be a die-off associated with that. And then you start very, very slowly and carefully adding fermented foods into the diet. Sometimes as little as 1/4 of a teaspoon of sauerkraut juice that you would put into a soup or some other kind of food, and then slowly, very slowly increasing it. And so you try to take advantage of things like fermented juices, fermented vegetables, fermented fruits, fermented dairy, fermented grains, and you add probiotic supplements. Now you noticed I said dairy and fermented grains, and I said before that's something, the gluten-free, casein-free diet. So you can tell that that is going to be much, much later in the process when we start to add that into the child's diet. Okay, so we've got the nutritional aspect of the protocol, but now we have the supplementation. Dr. Natasha is of the belief that you should not over-supplement the diet because there are so many fillers and so many additives in the supplements themselves that you actually can create more problems than what you're fixing with the supplement involved. And so she tries to be very stingy with what the child gets. She is very, very strong about the fact that there needs to be an effective probiotic. And there are a variety of them on the market. I've been test driving one Dairy allergy, that can be very, very difficult for them to take, to find a supplement that they can take, because almost all of them have a trace amount of dairy in it. Most people, even if they have a dairy sensitivity, can tolerate it though. And so we kind of will test you out before, do a test run with it and make sure you're going to be okay with it. There's actually an allergy test that Dr. Natasha uses, and it's something you do at your home. If you think you may be allergic to something, you mix it up with a little bit of water at nighttime, and you spread about a quarter-size spot on the inside of your wrist, and you let it dry, and then you go to bed. And you wake up the next morning, and you take a look at your wrist, and you see, is there a red spot? Is it itching? Is there any kind of reaction at all? If there is no reaction at all, then you can try a very small amount of that food and try and eat a little bit of that and see if you can tolerate it or not. So, the other essential thing is the fatty acids, the omega-3. Our diets, because we've had so many processed foods, are very high in omega-6, very high in inflammatory type oils. And so what we're trying to do is to get back to the omega-3s, and everybody's heard about that for heart health. You know, how you need to take your omega-3s, take your fish oil. And Sandy and the crew brought some of the fish oil back on the table, and they carry that out at Oriana's. And those are good brands. Cod liver oil. Now, I don't know, did anybody remember hearing about this when their grandmas and grandpas, or maybe great-grandmas and grandpas, used to all take cod liver oil? It's very high in vitamin A and vitamin D. Both are fat-soluble vitamins. Both are known as antioxidants now. You hear about those, you read them in Woman's Day magazine and Red Book, and you see it on the news all the time about how important those vitamins are to our health, and it is true. And so she uses, she prefers the fermented cod liver oils that you can get, although you can take the regular, but you have to take twice as much of it. So if you're not a real big cod liver oil fan, I vote for the fermented ones because you only have to take a little bit, like a half a teaspoon. And then there's digestive enzymes. A lot of times these children do not have the pancreatic enzymes to break down the fats, carbohydrates, and some of the proteins that they need. And so they sometimes will need to take, quite often they need to take digestive enzymes. And also if you don't have enough stomach acids and you're not digesting your meats well, sometimes you need to take products like Pepsin or betaine or something like that. So all of those you can determine by doing a full health history on what's going on with the child, and depending on different types of symptoms as to what kind of supplement they would be recommended to take. And then the third piece of it is the detoxification. The idea is to reduce the toxic load. Now, I don't know if you look underneath your sink or you go out to your garage and you see how many toxic things we keep in our homes. So there's cleaning chemicals, there are paints. Carpeting is a wonderful outgasser of all kinds of disgusting chemicals. Pesticides, cosmetics, toiletries, laundry soaps. Have you ever read the back of your shampoo bottle? It has all of those things in there again that you can't really pronounce. And a lot of people say, well, the skin is the biggest organ in the body, and our skin does wonderful things for us. And it keeps out all the toxins, and it's a barrier for us, which is kind of true. It's a semi-permeable one, means it lets some things through. So if you are overheated, if you're in a hot shower perhaps, all of your pores open up, which allows you to absorb all of those chemicals so well. Another wonderful thing is the suntan lotions that we use. They're not so wonderful actually. They have a lot of chemicals again in them. And so we slather them on, and we go and we lay out in the sunshine, and we bake it into our skin. And so Oriana's has a lot of, has some products that you can use that are far less toxic. Either that or go out in the sunshine in the morning or in the late afternoon, and don't put anything on And then you get to absorb that wonderful vitamin D right from the sun. In order to help detoxify, usually autistic children do not have a very strong detoxifying pathway in their body. Now we usually will get rid of things in our body if our bodies are working right. We'll usually get rid of them through the liver, through the kidneys, through the skin, and by breathing. And with autistic children, their livers and their kidneys are usually not functioning so well to process all of these things and get rid of them. And so what happens is all of that deposits in their body, deep in their organs, and if they have any fat tissue, it will absorb into the fatty tissues. So to help them get rid of it, you might want to bathe them in Epsom salt baths, like a half a cup into a bathtub and have them soak in that for 20 to 30 minutes. You can use sea salt, apple cider vinegar, they can come out smelling like a salad, bicarbonate of soda, or seaweed. And I know that Oriana's has a seaweed powder that you can use in the baths. Fresh juicing is also an excellent option. Dr. Natasha is not wild about any jarred juices because it has to be pasteurized. And pasteurizing kills bacteria, which sounds like a good thing, just like antibiotics sound like a good thing, and they can do good things. But they also take out all bacteria. And we need to have some exposure to bacteria in order to train our immune systems and keep our immune systems strong. So fresh juicing is a wonderful way of getting rid of toxins. Saunas, and then sunshine, that natural vitamin D. It's impossible to overdose on vitamin D that you get from the sun. Your body knows how to regulate that. Even if your body is toxic, it still knows how to process it so that you don't have a vitamin D excess in your body. And Dr. Natasha is so cute because she was telling us about how I think it's Moscow, how in the wintertime people will like fling off their clothes and they'll go and they'll lay against this one wall in Moscow. And she said, even then you see all these naked people around and they just know they have to have that sunshine in the middle of winter. I had that vision in my head, I couldn't get rid of it. So those are the things that we can do and that I know how to handle as a GAPS practitioner. There is another piece to the puzzle when you're working with autistic children, and that has to do with the behavioral piece of it. So you can do the things that you can do with the diet, although Dr. Natasha had the situation that when they started their son, they had to do ABA first, the applied behavioral analysis, because he absolutely would not eat the foods that she wanted to give him. And so they had to actually develop a protocol with their ABA therapist to, and they actually flew that person over from California, from a clinic that Dr. Rimland had. And they had to develop an entire strategy for how to introduce these foods to her son because he absolutely refused to eat. And I am not an ABA person. We would have to find somebody who knows how to, and it doesn't have to be ABA, but it needs to be some type of a format where it's one-on-one, intensive, and structured in order to help with making the conversion with the diet. Because GAPS children miss a lot of learning. Their toxicity prevents their brains from processing the information properly. They may not hear, see, taste, or feel the same way as other children do. Their brain cells do not develop normal connections and normal circuits. Early intervention increases the ability of the child to catch up on normal development. And she definitely recommends something like ABA, where it's very one-on-one and very intensive, to help get the behaviors into better control and help the child to learn how to manage. So the resources for you are obviously the book that's on sale in the back. There are these two websites, gaps.me and gapsdiet.com. And I would highly recommend either one or both of those sites, actually. The one I like about gapsdiet.com is if you look in the resources section, there are some articles that are written by Dr. Natasha that are very straightforward. And she is a no-nonsense woman. And she tells it exactly the way she sees it. And so it's wonderful to hear, you can't hear her obviously, but you can go on YouTube and hear her actually. If you put Dr. Natasha Campbell-McBride on YouTube, you can actually listen to some of her lectures that she's given or interviews that she has given. Also, if you get Dr. Joseph Mercola, mercola.com, he also has a good 2.5 hour interview with her. That's quite fascinating, I think, if you've got the time. Then locally, we have the business that I started this year called Traverse City Gaps Consulting. And I've got flyers back there, or business cards back there. I've also got the postcard here, which allows people to have a personal evaluation done for $99. And normally it costs $129. And really what that entails, it's a 1 to 2 hour health history. And I meet with the parents first, without the child present, to find out the status of the child's health and how things have gotten to this point with the child. We talk about any major concerns that the parents have, and then we talk about what challenges would be anticipated both with the child and for the parents for trying to implement this protocol. Then the parents go home. I contemplate this for a couple of weeks and try to come up with a customized plan, including tips for implementing the protocol. I try to find recipes that will fit in with the likes and dislikes of what the child prefers in their diet. And we talk about what type of supplements and how to schedule implementation of it, because it isn't something that you can just go in and go, boom, done, okay. We started this on Monday and it's the weekend and everything is in place. This is something that needs to be unfolded over weeks and weeks of time. Then we have our follow-up appointment about 2 weeks later, and we discuss protocol recommendations. I also highly recommend that people find a way either to do a monthly membership with me, or come to the GAPS group meetings, or set up personal appointments afterwards, because it's very likely that as it gets implemented that there's going to be some sticking points along the way and some difficulties to overcome, and that I can help with that. Because I'm a GAPS practitioner, we have a website that I go on to every week and read what other practitioners are going through. Now at this point there are 160 GAPS practitioners in the United States. There soon will be 320 after this fall, because Dr. Natasha is coming through America and she's doing another round. So then we'll have twice as many of us in America. She's also doing sessions in Australia and in England and in the main part of Europe. And so she's trying to get around to get as many GAPS practitioners as possible, because she's one woman and she's burning out from the crushing need that is worldwide, not just for autistic children, but for anybody with these GAPS conditions.